Because I'm one badass mofo. Alright, so up here, if we want to follow the veins, notice we have the jugulars here. This would be the transverse jugular. That way? Across, yeah. And this little blue one that runs parallel to the carotids on both sides is called the internal jugular. And this would be the external jugulars. When the superior vena cava comes up, it splits into two branches called the innominate veins or brachiocephalic veins. They give rise to the internal jugular, the subclavian, and the external jugular. Same on this side, you have internal jugular, external jugular, and subclavian. This branch is called the internal mammary vein. It goes to the breast tissue. Of course, these vessels here are the intercostals, which is easy enough to figure out on your own. Underneath the lungs, on the right-hand side, you have a fairly large vein that comes up and immediately enters the superior vena cava right before it enters the right atrium. That's called the azygous vein. A-Z-Y-G-O-U-S. From the superior vena cava and from the inferior vena cava, we have blood entering the right atrium. One other structure dumps into the right atrium would be the coronary sinus, which would be in this region right in here. So we have atrial blood from the coronary sinus, the superior, and the inferior vena cava entering the right atrium. Notice we have the anterior interventricular sulcus here with the anterior interventricular artery. That kind of gives us a rough idea about what is right ventricle and what is left ventricle. Of course, if you look at the base of the heart, the major trunks are the pulmonary trunk. Notice this fat tag? Always the aorta. Okay? You find that fat tag right behind the pulmonary trunk, that's the aorta. So we have our aortic trunk here, arch of the aorta, and then right behind it is superior vena cava. The arch of the aorta gives rise to two major vessels above the diaphragm. It gives rise to the brachiocephalic, which gives rise to the right subclavian, the right common carotid, and the left common carotid. The second major branch off of the arch of the aorta is the left subclavian artery. It gives rise to the axial and brachial arteries of the left arm. Blood from the right atrium travels over what valve? Into what chamber?
Goes to the right ventricle.
Yeah, what valve? Oh shit, come on. I can't believe this. Tricuspid. Tricuspid. It's the valve that has three valves. Valve that has three leaflets. Alright, what are these structures right here? In the ventricle? They're attached to the lips of the
papillary muscle.
Papillary muscle right here, but these fibers are called what? Chordae tendineae. Alright, so blood from the right atrium over the tricuspid valve. What is the purpose of the chordae tendineae and papillary muscles? Prevention of prolapse of the atrioventricular valves. So that blood, when the ventricles contract, does not go back into the atria, it goes to this circulation. We don't want stuff going backwards. Alright, from the right ventricle, blood travels through what? To get to what? Blood travels over the pulmonary semilunar valves to enter the pulmonary trunk. From the pulmonary trunk, blood goes to the right and left lungs. Okay? Blood back from the lungs, which is oxygenated now, travels back to the lungs, or to the heart, through what? Pulmonary veins. Pulmonary veins. They enter into the left atrium, okay? Or the blood, oxygenated blood, enters into the left atrium. Travels over what valve into the left ventricle? Mitral valve, thank you. So from the left ventricle, travels out the arch of the aorta to the brachiocephalic, the left subclavian, And then below the diaphragm, the first two major branches. The first major branch below the diaphragm is the celiac artery. The celiac artery gives rise to the hepatic, the gastric, and then the splenic. So the celiac actually becomes the splenic after the gastric and hepatic artery branches have been branched off. The next branch off of the aorta is the superior mesenteric artery. Next branch is the adrenal lumbar. That's the adrenal gland. So you have adrenal lumbar artery and adrenal lumbar vein. The next branch, renal artery, renal vein. You have a male. So this artery right here is called the internal spermatic artery. Internal spermatic. In the female, it would be the internal ovarian. It arises from the renal arteries and veins. Following the aorta down, past the superior mesenteric, past the adrenal lumbar, past the renals, we get to the next major branch right here. What structure is this right here? Descending colon. So this is the inferior mesenteric artery. The inferior mesenteric artery supplies the descending colon. Okay, so that's that branch right there off the aorta. Next branch off the aorta, iliolumbars. Notice it goes to the ilium, or the iliac crest, and to the lumbar vertebrae. Thus the name iliolumbars. Following the aorta down further, we see that the aorta actually has four divisions. We have two big ones here on the outside called the external iliac arteries. And then inside the V of the external iliac arteries, we have two more arteries branching off right here, internal iliac arteries. And inside the V of the internal iliacs, we have one artery branching off straight backwards called caudal. It goes to the tail. I can see it right here. There we go. I got it picked up for you right there. See it? It dives straight backwards to caudal. Alright, now for the veins. Remember iliolumbar veins? The inferior vena cava comes down and splits into two common iliac veins, different from the arteries. Remember, the aorta branches into external iliacs and internal iliacs and caudal. The inferior vena cava, on the other hand, branches into two branches, common iliac veins. Alright? From the common iliac veins, if you work your way down into the pelvis here, some, get this fat out of the way here a little bit. There you go. See that little blue branch that I picked up right there? That's the internal iliac vein. It dives straight back. It dives straight back. It's the internal iliac vein. It comes off of the common iliac vein. When the internal iliac vein comes off of the common iliac vein then becomes the external iliac vein. Okay, so you have common iliac vein, internal iliac branch, and then the common iliac becomes the external iliac. And then the external iliac becomes the femoral.
Is that the deep femoral or femoral?
We're just going with femoral, okay? We're not screwing around with deep femoral. Alright, so this is femoral artery and vein. For the mesenterics, notice you have a yellow. We have the mesenteric supply. It's still venous blood, okay? But we have separated the mesenterics with yellow because we want you to understand that there are two separate venous blood flows in the pelvis or in the abdomen. You have the inferior vena cava, which is draining the muscles of the legs and pelvis and the abdomen of its deoxygenated blood. But the mesenterics are draining the intestines Of course, the body conserves water. How? By extracting water from the feces as it flows through the colon. And the body extracts nutrients. How? Through the mesenterics that pull in the nutrients in the small intestine. So this is our inferior mesenteric vein, yellow, parallel to the descending colon. Notice the inferior mesenteric artery is here. Okay, but the inferior mesenteric vein is here. Now notice also that we have a superior mesenteric vein. Of course, you have your greater omentum, the omentum. But notice here we have a big yellow supply of vein here. So this inferior mesenteric vein and this superior mesenteric vein, and notice all the little yellow fingerlets in the small intestine.
I have a pen.
They're draining the nutrients that you have ingested in your diet. They're bringing them all back to the superior mesenteric. The superior mesenteric and the inferior mesenteric, lo and behold, come back together into the portal hepatic vein, right here. Okay? So now we have, notice, look, the inferior vena cava is entering the liver, so is the portal hepatic vein. This region is called the porta hepatis. The liver is shaped like this, it's dome shaped, so you have a cup there. That's why it's called the porta hepatis. So the portal hepatic vein is bringing the nutrients from the small intestine and the water from the large intestine back to the liver to be dispersed for nutrition. The inferior vena cava is coming back, draining the deoxygenated blood below the diaphragm. In the liver, these nutrients and things are going to be spread out into the portal hepatic cells. They're going to be drained back into a structures called central veins. They merge together, and lo and behold, they all join together with the inferior vena cava and leave the liver as one exodus of the inferior vena cava on the top of the liver. So we've gone from 2 to 1. So now all the nutrients and stuff that have entered through the portal hepatic vein and all the deoxygenated blood that has entered the inferior vena cava are then transported back to the heart in a common structure, the inferior vena cava above the diaphragm, into the right atrium. Okay? That's it, guys.
So that's the small intestine, that's the oral.